Hello. In this video, I'm going to explain the very commonly used drug acetaminophen. Acetaminophen is the generic name. It's also known as Tylenol. So first off, what is it? It's the most widely used non-prescription analgesic and antipyretic. So it is an over-the-counter drug used as a painkiller and fever reducer. Although it's not just used over the counter, it's commonly given in hospitals, particularly in the ER, the ICU, and the OR. It is only used in mild or moderate pain, and it's often given in conjunction with other medications. So a little bit about the history. It was first made in 1877. Being around for a while, it has been tested and proven to have good efficacy. It received its patent from the FDA in 1951 and was available for sale in the US in 1955. It was an accidental discovery. It was actually given to a patient who had a parasite and was found to reduce their fever. Okay, so here is a picture of the structure of acetaminophen. It consists of a benzene ring core, one hydroxyl group, and an amide group in the pair 1,4 pattern. It is an extensively conjugated system, and the presence of the two activating groups makes it highly reactive to electrophilic substitution. Okay, so now I'm going to discuss some of the therapeutic use. It is the most widely used non-prescription, non-opioid analgesic and antipyretic. Being a non-opioid, it has less side effects and chances for addiction. Acetaminophen is used therapeutically to treat minor aches and pains due to things like the common cold, arthritis, headache, backache, toothaches, muscular aches, premenstrual and menstrual cramps, as well as temporarily reduce someone's fever. In the United States, acetaminophen is available as 325 milligram and 500 milligram preparations, and as a 650 milligram extended release medication that's intended for arthritis treatment. It comes in many forms, including drops, capsules, and pills, as well as various children dissolvable, chewable, and liquid formations. It's also available in forms such as solutions, tablets, suppository, powder, capsule, syrup, suspension, elixir, and effervescent tablets. Okay, so for some of the physiochemical properties, it is an odorless crystalline powder that has a molecular weight of 151.16 grams per mole, a molecular structure of C8H9NO2. Acetaminophen has a boiling point of over 500 degrees Celsius and a melting point of 336 degrees Celsius, and a solubility of 5 milligrams per ml in water. Okay, so some of the pharmacological properties. Acetaminophen acts centrally as an analgesic and antipyretic. It is technically a non-steroidal anti-inflammatory drug, or an NSAID, but unlike typical NSAIDs, it has only minor effects on tissue cyclooxygenase activity. It weakly binds to COX-1 and COX-2 inhibitors, and so it's a weak NSAID and not given as a typical NSAID would be. It appears to produce its analgesic effect by increasing the pain threshold. This is thought to be done through inhibition of the nitric oxide pathway, which is activated by many pain neurotransmitter receptors. Okay, so for the pharmacodynamics, although it's a commonly used drug that has been around for a while, its mechanism is not actually well understood. Unlike other NSAIDs, it doesn't inhibit the COX enzyme very well. Acetaminophen is proposed to modulate the endogenous cannabinoid system in the brain. It does this through its metabolite AM404, which appears to inhibit the reuptake of endogenous cannabinoid by neurons, thus making it more available to be able to reduce pain. Okay, so for the pharmacokinetics, when taken orally, acetaminophen is absorbed rapidly in the GI tract. There is some absorption in the stomach, but it's considered to be negligible. It's primarily metabolized in the liver via three possible metabolic pathways, as you can see on the side. It can go through glucuronidation, sulfation, or anhydroxylation by cytochrome P450. All three pathways lead to non-toxic final products that are then excreted through the kidneys. Although there is an intermediate product in the cytochrome anhydroxylation by cytochrome P450 pathway, the intermediate is NAPQI, and it's believed to be responsible for the possible liver toxicity that acetaminophen can cause. Okay, so some other drugs that are in the same class or are used for similar purposes as acetaminophen include aspirin, ibuprofen, naproxen, and indomethacin. So as far as the dosing, adults 12 years and older should take 1,000 milligrams every 6 hours while symptoms last, or no more than for 10 days. The doses in children should be carefully considered and is recommended to be kept less than 75 per milligram per kilogram per day. Okay, and then for cost, it's a very affordable, easily accessible drug. Its retail cost is less than a penny per dose, and it can be found at any major drugstore. Okay, so things to consider when doing patient counseling. It does need to be stored from 20 to 25 degrees Celsius or 68 to 77 degrees Fahrenheit. Patients should be advised to not exceed more than 4 grams daily. Some studies recommend doing no more than even 3 grams daily. Acetaminophen is a frequent component in many over-the-counter and prescription combinations with decongestants and antihistamines for cold and allergy symptoms or as a sleeping aid. So make sure they're aware that they could be getting acetaminophen and other drugs that they're taking that they're not aware of. They should be advised to notify their doctor if they become pregnant and to use acetaminophen in pregnancy only when needed, and no safer option for pain or fever relief is available. Acetaminophen poisoning does remain one of the more common drugs taken in overdose with potentially fatal consequences. Early recognition and prompt treatment with N-acetylcysteine can prevent hepatic injury. They can be told that it doesn't matter if it's taken on an empty stomach or with food, and then to limit alcohol intake to reduce the amount of stress put on the liver. Okay, so some common adverse effects or side effects. Oral and rectal dosing may cause skin rash and itching. Acetaminophen can decrease sodium bicarbonate, serum calcium, and serum sodium. IV dosing may cause nausea and vomiting. Some other side effects include dark urine, jaundice, loss of appetite, and upper stomach pain. Okay, so some important drug-drug interactions. Alcohol may enhance hepatotoxicity in acetaminophen use. Barbiturates may actually increase the metabolism of acetaminophen. Vitamin K antagonists such as warfarin may have their anticoagulant effect enhanced. So patients who are on things such as warfarin should be monitored for increased risk of bleeding. Several oral acetaminophen and acetaminophen combination products, particularly flavorable chewable tablets, contain the artificial sweetener aspartame. Aspartame is converted into phenylalanine in the GI tract following ingestion. Chewable formulations of acetaminophen products may also contain phenylalanine. So phenylalanine content should be considered when these products are used in patients who must restrict their intake, such as patients who have PKU. Okay, so that's all the information that I have concerning acetaminophen. Thank you for listening, and I hope that you found this video to be informative. Acetaminophen has been used for a long time. It's considered to be safe in both adults and children. And then on this next slide, I just have all my references listed.